Welcome back. President Trump says he's cutting drug prices by up to 80% and fast. He just announced a new executive order that could slash the cost of prescriptions for millions of Americans almost immediately, tying U.S. prices to what the cheapest countries in the world are paying. A plan like this sounds huge, but will it really reach the people who need it most? I'd love to hear how you feel about it. Have high drug costs affected you or someone you know? Share your experience in the comments. And if these breakdowns help you stay in the loop, consider subscribing. So what exactly is this all about? President Trump announced what the plan says, that he'll be signing a new executive order, something he's calling one of the most important in American history. The goal is to cut the cost of prescription drugs by anywhere from 30 to 80%. Now that's not just a small discount. For someone paying $600 a month, that could drop to $120, and that's not down the line. He says the effects could be felt almost right away. How? Through something called a most favored nation policy. This means the U.S. would stop paying more than any other country for the same exact medication. If another country, say Canada or Germany, is getting a drug for less, then we would match that price. The hope is this forces drug companies to lower what they charge here, making things more fair for American patients. And it's not the first time Trump has pushed for this idea. Back in 2020, near the end of his first term, he tried a very similar move, but it was blocked by the courts. The argument back then was that Medicare didn't have the power to negotiate prices. That changed in 2022 when Congress passed a law that finally gave Medicare that authority, at least for some drugs. So now Trump's bringing the "what drugs are covered" plan back. He says it's going to save Americans trillions over time, while also lowering insulin prices to just 3 cents per dose for low-income patients, and cutting the cost of epinephrine down to $15. That all sounds amazing, right? But let's take a breath here, because whenever a change sounds too good to be true, there are always questions worth asking. For one, how will this actually work? What drugs are included? Is it just the expensive ones used in cancer treatments or hospital visits? Or will it include the medications you pick up at your neighborhood pharmacy? And how soon will these price cuts show up? Some things could move fast. Others might take months or get caught up in legal fights again. Well, here's what we can say right now. Based on what Trump and the White House have shared, the focus seems to be on drugs covered by Medicare, especially those administered in doctors' offices or hospitals. So that would include things like cancer treatments, infusions, and injectable medications. That's where the government spends a lot, and its chapter, Trusted Medicare Support, where they think the biggest savings could come from quickly. Just pausing for a moment to share something that could really help you or someone you care about. If you're 65 or older, or helping someone who is, you probably know how overwhelming Medicare can feel. Mailers, the endless calls, all claiming they have the best plan. It's exhausting. When my team and I were looking into this, we came across Chapter, and what stood out wasn't just that they compare all 24,000 plus plans, it was their story. The founders built Chapter after their own parents got stuck in the wrong Medicare plans, and they realized just how many people were being misled or pressured into making choices that weren't right for them. That's what makes Chapter different. Their advisors aren't paid to push one plan over another. They're salaried, independent, and genuinely there to help you. You'll speak with a real person who takes the time to understand your doctor's prescriptions and preferences and helps you make a decision you feel good about. And the call is totally free. No pressure. No gimmicks, just honest support. If you're already in the right plan, they'll tell you. And if not, they'll help you find one that better fits your needs. If you want to talk to someone today, Give Chapter a call at 615-639-1937 or visit askchapter.org/money. Again, that's 615-639-1937. It's free and it might save you a lot of stress. All right, now let's get back to it. Now what about the meds? Everyday meds and when prices might drop, you pick up at the pharmacy, like blood pressure pills, cholesterol meds, antidepressants, the everyday stuff that's less clear. Some of it might be affected over time, especially if the government starts pushing for similar pricing rules across the board. But right now, most of the talk is still centered on Medicare and higher cost treatments. As for the timeline, it's a little tricky. Trump said the effects could be felt almost immediately, and in some cases, like changes to how Medicare reimburses hospitals, that could start rolling out pretty fast. But for broader price cuts, especially those tied to international price matching, it's more likely to take months. That's partly because the health department still has to go through a public comment period and then finalize the rules. And like last time, there could be lawsuits that slow things down again. So yes, some patients might notice lower costs sooner, especially within Medicare. But for others, it could take longer. And for some medications, there may not be any changes at all, depending on how the policy is written. Also, this isn't happening in a vacuum. The pharmaceutical industry is pushing back hard. They argue that cutting prices this much could reduce the money drug makers invest in research and development, meaning fewer new treatments down the road. Some experts even warn that this could cause drug shortages if companies decide it's not worth selling here under the new pricing rules. And another thing to consider, access. Even if prices drop, will all drugs still be available? Or could insurance plans start dropping certain medications to avoid the costs? Now, Trump's executive order isn't just about matching international prices. It also includes other moves, like tying Medicare payments for some drugs to what hospitals actually pay for them, which could lower prices by another 35%. He's also pushing to make money, help states import cheaper drugs from abroad, and expand support for diseases like sickle cell. What happens next? It's a big package, and if it works as planned, a lot of people could benefit. People on fixed incomes, seniors, folks who've been rationing their medicine. This could bring them some real relief. But like anything in Washington, it all depends on the follow-through. Will this order hold up in court this time? Will it be blocked again? And what will Congress or the pharmaceutical lobby do in response? One thing we do know is this. The U.S. currently spends about $400 billion a year on prescription drugs. That's often 2 or 3 times more than what other wealthy countries spend. And it's not because our drugs are better. They're often the exact same, made in the same factory by the same company with the same label. When you hear about a policy that could bring American prices in line with what other countries pay, it makes sense why people are interested. But again, it's not just about the promise. It's about the structure, the execution, and whether the system will really deliver for people who need it most. Now I'm curious to hear from you. If you've ever delayed filling a prescription because of the cost or skipped doses to make your supplies stretch, you're not alone. And if you've had success with affordable generics or price negotiation programs, share that too. These are the kinds of real-life stories that help us all understand the impact behind the policy. Also, keep in mind, there's still a lot that's unclear. We don't have the full text of the executive order yet. And even though the president says it's being signed at 9 a.m., we'll need to see how it's enforced and how quickly any of this actually happens. So we'll be watching closely, not just for the headlines, but for the real effects on everyday people. And if this kind of thoughtful, grounded update helps you stay informed, consider subscribing and turning on notifications so you don't miss what comes next. I'll be breaking it all down as clearly as I can, and I always try to keep things balanced and fair. Thanks for spending a little time with me today. Stay safe, stay sharp, and I'll see you soon.